Good morning. I will present findings from the Sensor Pesticides program. These findings show that acute pesticide poisonings in the United States remain a source of concern. Sensor stands for Sentinel Event Notification System for Occupational Risks. The approach is to use Sentinel case identification, follow-up, and report to a state surveillance center. By identifying Sentinel acute pesticide poisoning cases, public health authorities can assess the root causes for those cases, and then apply lessons learned to prevent future cases. In partnership with the state programs and the EPA, the Sensor Pesticides program tracks acute pesticide poisonings in the United States. The case definition for an acute pesticide poisoning case includes acute adverse health effects resulting from exposure to a pesticide product. A case is characterized by 1. Acute onset of 2 or more new adverse health effects. 2. These effects are temporarily related to a documented pesticide exposure. And 3. There is consistent evidence of a causal relationship between the pesticide exposure and the health effects. This report includes more than 33,000 cases of acute pesticide poisonings from 1998 through 2018. The table presents the activities that the persons were performing at the time of the pesticide exposure. In summary, most cases were exposed to pesticides when using pesticides at work. However, it is of concern that about 23% of cases were exposed to pesticides while doing routine living activities not involving pesticide application. Pesticide poisonings were considered occupational when the pesticide exposure happened at the place where the person worked. The severity of pesticide poisonings was classified into 4 groups using standardized criteria. In low severity cases, the condition usually resolves without treatment. In moderate severity cases, the condition is not life-threatening but requires medical treatment. In high severity cases, the condition is life-threatening, requires hospitalization, often more than 5 days are lost from work, and might result in permanent impairment. Our findings suggest that acute pesticide poisonings continue to be an important public health problem in the United States. These findings reinforce the need for increased efforts to better protect workers and bystanders from pesticide exposures. Thanks.